Hello, I'm Dr. Peter Lakowski and I'm a sports specialist chiropractor. Today we will discuss two additional conditions that cause sciatica, lumbar spinal stenosis and piriformis syndrome. Let's start with lumbar spinal stenosis. The most common case of lumbar stenosis is called degenerative lumbar spinal stenosis and is due to several age-related and post-injury sequelae leading to mechanical compression of the spinal nerve roots within the spinal canal or the intervertebral foramen. As the individual ages, discs naturally change from tall and plump structures with high water content to a stiff, dehydrated, flatter cushion. This loss of height leads to the approximation of the adjacent vertebrae, narrowing the intervertebral foramen. This also approximates the posterior spinal structures, increasing their propensity for wear and tear and eventual arthritic changes. In addition, due to the loss of disc height, the soft tissues that help stabilize one vertebral segment on top of the other become less taut, which results in subtle intersegmental instability. This instability increases shear forces that may cause end plate spurring, ligament thickening, further degenerative changes in the disc and the facet joints, and even vertebral alignment issues, all potentially limiting precious nerve root space. Spinal stenosis can result in progressive neurological compromise, as well as classic sciatic nerve pain. The pressure on the nerve roots can be exacerbated by extension movement of the spine, as this has been shown to narrow the already compromised spaces even further. In the more progressed cases of lumbar spinal stenosis, even erect postures can aggravate symptoms. A common presentation includes pain with prolonged walking and standing. Now let's move on to yet another cause of sciatica, piriformis syndrome. Piriformis syndrome differs from the other conditions we've covered in our discussion because it's the only one that doesn't originate from the spine. The piriformis, a deep posterior gluteal region muscle, originates from the anterior surface of the second through to the fourth sacral vertebrae and courses laterally under the greater sciatic notch and through the greater sciatic foramen to attach to the greater trochanter of the femur. As you can see, the piriformis is intimately related to the sciatic nerve. Any spasm, contraction, hypertrophy, or swelling within the muscle can potentially compress the sciatic nerve and lead to symptoms just like compression of the nerve roots at the spine. This can result in a classic presentation of sciatica, making the diagnosis difficult to differentiate from other causes. So how does somebody develop piriformis syndrome? A rare but important differential cause of true piriformis syndrome that occurs in about 5 to 10% of the cases is related to the anatomical variation of the sciatic nerve or the piriformis muscle. In this case, the nerve or its division can be embedded within the belly of the muscle or in between the two heads of an anomalous muscle, leading to compression of the nerve. Overuse is the most common cause of this syndrome and is often seen in athletes such as runners who exhibit poor technique or inadequate effort from other important gluteal muscles, leading to repetitive overexertion of the piriformis. In this scenario, piriformis hypertrophy, fibrosis, or actual tethering of the nerve to the muscle are often considered the etiological factors leading to sciatic nerve irritation. So that brings us to the end of our discussion. Thank you for joining me today.